Hello and a very warm welcome, viewers. You're watching the brand new edition of India Fights Back with your host, Kriti Mishra. The Health Ministry has emphasized that predictions about a third wave of COVID should be taken very seriously. This is the third warning on the subject from the centre. Prime Minister Narendra Modi on Tuesday said that the focus should now be on how to prevent a COVID-19 third wave rather than discussing when it would hit India. The Prime Minister's comments to Chief Ministers of northeastern states came even as top union government officials highlighted evidence to show the third wave already forming around the world and stressed the need to immediately step up measures and be vigilant. The Prime Minister strongly cautioned against crowding at hill stations without observing proper precautions, rejecting the argument that people want to enjoy before the arrival of the third wave. He said that this need to be understood, that the third wave will not come on its own. He also said that the main question in our mind should be how to prevent the third wave. Experts are repeatedly warning against carelessness and crowding as they can lead to massive surge in the cases. They have also advocated preventing avoidable crowding. And to discuss the way ahead, I am joined by Dr. Sunil Sanan, MD, Internal Medicine and Senior Physician, Mussoorie, Uttarakhand, and Dr. D.K. Gupta, Chairman, Felix Hospital, Noida. Welcome to Sunset TV, both of you, and thank you so much for joining us. And Dr. Sanan, coming to you first. Official figures show 35,425 tourists reached the outskirts of Nainital and 32,000 more travelled to Mussoorie in Uttarakhand over the last weekend as COVID figures dipped across the country. 8,000 tourist vehicles sent back from Mussoorie and Nainital. How worried are you about this revenge travel, sir?
Madam Mishra, it's not a matter of worry. It is a matter of now or never. Tourism, to have a break, to enjoy some time, especially during summers, all the more after the last lockdown is over, and people have wrongly started feeling that it is now over. We are bound to have an influx of people unsurmountably in numbers. I only, for the first time in life, Dr. Gupta, we always have been very competitive in life. Everybody is. For the first time, I'm feeling happy that Mussoorie stands second, not first. That Nainital attracted 3,000 more people than we. Is it that people who are coming to Mussoorie are more sensible? Or we have given them signals, or is it truly the administration, the police bandobast, which has repelled them back? So we have been saved by 3,000 visitors for the time being. They are our bread earners. Our socioeconomic sustenance depends upon tourists. It is historical. It is also spiritual and philosophic in terms of the Char Dham Yatra, which attracted 32 lakh tourists in 2019, and presently they have been stopped from going ahead. The worry is definitely, the red flag is on. It is time that we may, for this bombardment likely, get entrenched. If we try to say that let's earn something more for the coming fortnight, but seemingly there will be no bombardment for the time being, it will be very foolhardy for us as people benefiting from tourists. It'll be equally irresponsible on part of the tourists to think of, go, let's have a change and have a feel of the cold mist of Mussoorie. If they can, may they still hold on in their homes. Keep as cool as possible. Keep moving in numbers. Ensure that you come visit Mussoorie, Nainital, and other hill stations only after you have ensured your reservations and you are registered. Ensure that you are COVID protected so that you do not suffer from severe morbidity or maybe mortality in certain cases. Ensure that that number may come instead of a whole group of 10, 15, 20 people as good friends traveling together to a hill station for summer vacation. Let's say, okay, I go now, may you go 5 days later. Companionship growing into a snowball of risk We ourselves may still come to Missouri, Nainital, Darjeeling, Kashmir, or wherever. Yet we may ourselves at distant locations like Delhi, Noida, Ghaziabad, wherever, cut down our visits to the hill stations in slabs. That can definitely, because people often come up in groups because they enjoy together. So can we curtail that is one way that we can cut down. To say that no tourists should come also seems not very practical and not what the government either will appreciate. This is my first reaction to your question, Madam Mishra.
All right, so that was a very good phrase that you used, Dr. Senin, now or never. All right, Dr. Gupta, coming to you now. The government says that warning of the third wave are being taken very casually and are discussed in the manner of weather reports. What are your thoughts, sir?
I think I'm fully agree with the fellow panelist. And we have seen the photos and videos of tourists flocking to the popular destination. They have gone viral in recent days. And we have seen that nobody was wearing mask or maintaining social distancing in these public places. However, the cases has been down around 40,000 per day in recent weeks. But still, the R factor, that the reproductive rate of this virus, means the replication rate of this virus has been increased in July first week as compared to middle of April when it was on peak. It means it can be early start of third wave, or we can say we have not controlled the second wave till now. And because this is happening because we are not able to vaccinate people as fastly as we needed. Vaccination is not as per our requirement. It should be around 90 lakhs per day, 89.6 lakhs per day if we want to inoculate 60% of our population by the month of December. But average vaccination per day is around 35 to 40 lakhs, and that is at least it is gone down around 25% in recent 2 weeks also. Like we were inoculating more 2 weeks back, but now it is gone down in this week also. So I think there are so many other factors also they are responsible, and both government and the public both are not they are not serious, and they are accountable and responsible for the third wave if it happens, and it will be early third wave. We were expecting third wave in September or October. Because of this irresponsible behavior of our citizens, we will have this wave maybe in this July only it can start, or it can go maximum first week of August. As per current data and current trend of this public and the virology and epidemiology of the virus, we are taking it now. And I will tell you that we should definitely hold this all tourist bonjana or pilgrim travel, religious travels, so that we can stop this replication or stop this chain of transmission. Even Uttarakhand government, they have, I think, stopped this Kambar Yatra. Even today, Supreme Court of India, Honorable Supreme Court of India has issued notice to center and the state government of UP for holding this Kambar Yatra. I think these religious gatherings should be avoided at least for next 6 months till we are at around 60% vaccinated. Otherwise, it will definitely create epicenters or super spreader events. So that, and they will go to their destination, their districts or their states, and they will carry these viruses. And these viruses will replicate, and definitely that can lead to new viruses, new variants, new strains, and they can be troublesome. They can create new problems, because we know that if there will be a major shift in the virus, there are two types of mutation. One is genetic drift, and the second is genetic shift. Yes. The genetic drift we need not to change the our vaccine, and there is no change for the medications, or there is no treatment guidelines changing requires for this genetic drift. If genetic shift happens, means if there is a major change in the genome of this virus and it becomes more virulent, definitely we have to change our vaccine also, and maybe our current guidelines, current treatment will not be effective against this virus. Therefore, we should be very cautious against development of new strain, and this can only happen when we will be able to stop this transmission. If we are not able to transmission or replication, the mutation will be happening again and again. Sometimes in several mutations, there can be one mutation that can be more harmful, more virulent for us. Therefore, I will request government they should be more accountable, they should be more enthusiastic, and the law and order should be more strict, and it should be implemented at ground level. Otherwise, like there are guidelines, there are SOPs, if they are not implemented, we will not get the result. That is happening in the states. If you cross the tier 1 cities, tier 2 cities, go to tier 3 cities, you will not find masks. In rural area, hardly anyone will be wearing masks. If you see the tier 1 cities, only few people or like few percent, significant percentage of the population will be masked, but they will not be following the appropriate mask wearing behavior also. Their mask will be below the nose and they will not be following it every time. So these type of careless behavior from the public, and also the poor implementation of the guidelines at ground level is responsible from the different state governments for creating these epicenters. We should have serious concern about northeast states, Maharashtra, Kerala. They can be new epicenters of these new viruses, new strains can travel to different states of a country, and they can create a new wave of pandemic, new surge of pandemic. Definitely, there is new concern also that we have isolated 9 cases of Kappa virus also in few states. So there are Delta plus is available, Delta virus is available, Kappa is coming, Theta, Alpha, Beta. We were already fighting with them. So there are so many viruses, and these viruses can have different properties. And if these properties are against us, if they are more violent, if their R factor is high, means they are spreading fast. If they are giving more serious symptoms or producing more symptomatic patients, then definitely we have seen the tsunami of second wave in April and May. There will be shortage of beds, shortage of oxygen, shortage of ventilators, shortage of doctors, and this country cannot afford this at all because our infrastructure is not at par with the developed countries. Developed countries are investing around 10%, 10 to 15% of their GDP on healthcare infrastructure. We are spending around 1% to 1.25% for last 60 years, and last couple of years we are investing around 2 to 2.5% only. Means there is a huge shortage of infrastructure and manpower in our country if we talk about the medical treatment. And if we want to cope up with this pandemic, if we want to control this pandemic, there is only 2 ways we can apply. One is implementation, strict implementation of COVID-appropriate behavior at ground level, and public should be responsible and government should be accountable for this. Second, we should vaccinate as maximum as possible, because vaccination rate is going down in last 2 weeks, and even we have launched the world's largest program, free program after 21st of June. Still the rate is going down. I think there is a current need of increasing this vaccination production also, even distribution also, and inoculation also. And private players should play a significant role. I'm telling you, private players have their 25% quota. They are having stocks, but because of financial concerns, because of poor awareness, people are not coming up, they are not spending money, and they are not getting vaccinated in the private hospitals.
Dr. Gupta.
I will request government, and I will request that like corporate industries should invest money, party funds or their CSR fund, for inoculating these like public in private hospitals also.
Yes, sir. But you used 2 very important words. I'd like to borrow them from you. One, accountability, and the other one being responsibility. So before accountability, let's talk about responsibility. Dr. Sanin, if you look at the pictures from Mussoorie, Nainital and Himachal, while social distancing was a far-fetched goal, even masks were missing. How do we drive home this point that masks are for our own safety and not for evading fines?
See, this is a matter of practice or habit, awareness, and walking the talk. We talk of using masks. I knew that this can come up, it has to come up for discussion. I have a few to show. Here is a mask. Dr. Saab knows all about them very well. I have worn it or donned it. This may be quite loose from here, although it is maybe the best mask, called as N95. I wear it or I keep it like this so that I can breathe well. Here is another mask. Softer cloth mask, I'm donning it. And it is not really tight, I'll have to take off my spectacles for a moment.
Sure, sir.
This is not really tight from here as far as I am concerned. There is no awareness about how to use a mask if it is a bit loose. Mask agar thoda dheela hai.
Ji.
This is the ground reality. You tie a knot on the sides. Once you've tied a knot on the side and you wear it, it will become tighter for those where it was comparatively loose. And of course, it is to show the most easily available economical mask. Besides cloth, home tailored, available, distributed by social clubs, by the government. Next is something equally important because we are talking everything, whether it is alpha, beta, theta, gamma, whatever kind of viruses come, we have only one shield, ek dhal hai, which certainly works if we wear it well and adhere to look after it well. There are people who, poor fellows, have one mask and it carries on for days together.
True.
It has got up all the dirt that is visible and it has got up numerous bacteria and maybe these very viruses are on it. And what is required is that Dr. Sanan has his mask number 1, which he uses for one day, and ideally takes it off and drops it in carefully and uses the second one the second day, even if it is the most economical and easily available mask, so that they are kept separately. You would have seen some people on the television also who are donning a mask, who are wearing a mask. Let it be like this. I am wearing an N95 to feel proud. And then I'm about to appear before the audience. I'm being imaged, so I take it off and keep it in my pocket. Hold it like this, wrap it as if it is another hanky. We have in 1.5 years' time, we means whether it is the government, the medical department, the people, we, the people of India, have failed to understand and explain that the outside of this mask, if worn for a day and in the vicinity of people who may be having various kind of contaminants, may look white and clean, but it is dirty as muck. We cannot touch it, and then without cleaning our hands or sanitizing our hands, we cannot start having food or touch our nose or hands. Washing our hands and seeing that hands are washed and kept with the froth of the soap for 30 minutes or 30 seconds, or maybe a sanitizer, the alcohol-based sanitizer, for it to dry up.
Right, sir.
Applying it is not Ganga Jal. It has to dry. And if it doesn't dry, you have to move your hands. Even that little percentage of the urbans, for whom Dr. Gupta ji rightly said, it's a small percentage of people who are using and donning their masks. Are they really following these specific SOPs or rules?
Absolutely.
We have failed to convey it in almost 2 years' time.
True.
And the only thing that can stop it from going from one to the other without, how does an individual be aware that is there a virus around me or not? If there is an enemy, he comes with a lut or he comes with a weapon, we can duck and save ourselves. Unfortunately, this enemy is not visible and we cannot duck. We are just caught. So the only shield we have is a mask.
Absolutely, sir.
Distancing, social distancing is a must. But with the population and density of our population, footfall for tourists, and the small little size, Mussoorie is 64.4 square kilometers. And it can attract something like 30, 40 tourists, 1,000 tourists a day. We as fighters for environmental issues have been talking for years, for decades now. I've lost my hair talking about the carrying capacity of Mussoorie and the plan to see that we get only the limited number. But that is only a bhashan now. Now it is falling on us.
Absolutely,
it is
sir.
The people in the hill stations where tourists are coming. I, Sunil Sanan, another person, Mr. Sahani, another person, Mr. Dhondial,
Yes, sir.
We should be donning our masks all time for the tourists to realize that this town behaves and wants us to behave differently. We
Absolutely,
go
sir.
to a
Wearing a
five-star hotel,
mask
our
is
etiquette is
non-negotiable, Dr. Sanon. It is absolutely non-negotiable. And that was a very important illustration that you gave. And I'm sure our viewers are going to benefit immensely from it. But moving on to another important point, Dr. Gupta, which are the other countries that have experienced the third wave of COVID-19 already? And what are the lessons for us?
Currently, we have seen that there are so many countries experiencing third wave and fourth, like Europe. Whole Europe was experiencing third wave. There was a rise of surge in the Russia also. Currently, Maldives is suffering a lot. They are having shortage of beds, shortage of oxygen. Malaysia. These are the countries, those who are having the Delta variant in their circulation, community circulation, and that this is reacting the similar way that we have seen in this April and May month in India. And then we should have some lesson from these countries. If we will not be able to implement COVID-approved behavior and if we will not be increase our vaccination process, then definitely we can have similar type of situation in coming month in India also. As Dr. Sarin said, I am totally agree that we are not wearing or we are not following appropriate SOPs, standard operating procedure for the wearing mask also. And I will tell you one thing more, that mask is one thing important, but only mask cannot prevent is spread of this coronavirus infection. With mask, we have to also follow social distancing and frequent hand washing. Frequent hand hygiene is with social distancing and mask. This is fully effective, or otherwise, if we follow only masking and only hand hygiene or only social distancing, that is not effective. And as we know that these masks, surgical masks or medical masks or these we talk about this and like cloth masks, they are not very effective. They are giving false sense of protection, I'm telling you. So therefore, if we are not following other two parameters, then it will not be fully effective in prevention of this corona infection. Otherwise, like those high risk areas where social workers, where healthcare workers are there, they are using this N95 mask. That is definitely giving around 95% protection against this COVID infection. But if we see social gatherings or in markets or in tourist places, they are only wearing this fabric mask or cloth mask, and that is also not in proper way.
Yes.
They are not even they are not wearing it, or if they are wearing it, they are not following other two parameters, then it will be definitely very difficult to control this infection if it's one in similar fashion. The government has to take serious action on this, otherwise we will same similar threats or similar conditions like other countries right now facing in different places, different parts of the world.
Right, sir. So I just have last 90 seconds left on the show. Time for closing comments from both my guests. Dr. Sanon, preventing or averting the third wave, the onus is on us. What are your closing thoughts?
The onus is on each and every person. Government can feel responsible and can be made to feel responsible, can be alleged that was not responsible and competent. It is I and you who matter.
Yes.
It is soap which is hope. It is mask which is the shield. And maintaining a distance. It is time that we overnight change our behavior under the compulsions. If there is a bombardment, we get into a trench to save ourselves, not come out and say we will dance because it is submerged. Let us realize that it is literally a state of war and we have to fight it.
It's a state of war and we have to fight. We can't let our guard down. Dr. Gupta, your closing thoughts.
I think every citizen of India should have know their responsibility, and those should follow all COVID appropriate behavior. And government, state government, because health is a concern of state government, they should be accountable for implementing of COVID behavior guidelines at ground level. They should audit it, they should implement it, they should create awareness, they should do trainings, so that we can at least for next 6 months should follow all these guidelines till our population is around 60% vaccinated. Otherwise, we will have threats like third wave. It is at our doorstep. Anytime it can come and things can be devastated.
All right, so things can be devastating and the onus is on us. And with that thought of following the COVID appropriate behavior, thank you so much for joining us, Dr. Sanon and Dr. Gupta. So viewers, that's all we had for you in this edition of India Fights Back. But before that, let me remind you once again to wear your face masks, wash your face and hands frequently, and follow social distancing or physical distancing norms whenever you're stepping outside. Remember, these simple precautions are all it takes to defeat this pandemic. Take very good care and goodbye.